Welcome again. Happy to have you here at Schnepp's Media webinar, Healthy and Safe Together, What Families Should Know Before Returning to Childcare and Learning. My name is Elizabeth Aloni with Schnepp's Media. Schnepp's Media is the largest local news in New York City with over 70 newspapers, magazines, websites, webinars, podcasts, and events in Queens, Brooklyn, the Bronx, Manhattan, Westchester, Long Island, and Philadelphia. And today we're very lucky to have with us the CEO and COO of Vivvi, and we'll look forward to hearing all that they have to say and educate us about what is safe and what we need to know before returning to childcare and learning. So I want to tell you a little bit about them before we get started, and then I will hand it over to them. Charlie Bonello is the CEO, and Charlie co-founded Grand Central Tech and helped build it to New York's largest, most selective, and most inclusive tech ecosystem with over 100,000 square feet and over 100 companies under its purview. Most recently, he was a venture partner at RTP Ventures, where he was focused on Series A and seed investments in fintech, healthcare IT, and industrial IoT companies. Previously, Charlie held various roles at 3 Point Capital, River Twice Capital, and Fred Alger Management. Charlie holds a BA in History and Political Science from Tufts University. Welcome, Charlie. And with us as well is Ben Newton, co-founder and COO. And Ben has built his career working with startup schools. He was a member of the founding team of Avenues, the world school where he worked to launch the New York campus and lay the groundwork for multiple international sites. He also helped launch and manage several schools, including in New Orleans under Teach for America, and in New York City as Director of Business Development for Met Schools and General Manager of Partnerships for Wonder School. Ben received his MSc in Comparative and International Education from Oxford University and BA in International Relations from the University of Pennsylvania. So happy to have both of you here from Vivvi, and I'd like to hand it over for you to educate us.
Great, thanks so much, Elizabeth. And hi, everybody, welcome to today's webinar. We're so happy you're able to join us, and we're so excited to open our doors on August 3rd and to see so many other wonderful schools and childcare centers opening there shortly thereafter. I'm also excited to share with you what we've been working on all summer long in our partnership with New York Presbyterian, what we've learned from that experience, and how we're implementing it now. Now, I know we have folks from all over on this call, and I hope we have the chance to serve your families at Vivvi soon, but our goal, irrespective of where in the world you are, is to help your families navigate a safe return to school and childcare and to really be excited for it. Now, obviously, the last few months have been really disruptive and stressful for everyone. And while most schools were closed around March 15th, Vivvi was very lucky to be one of the few that was allowed to remain open throughout the COVID crisis because of our work with our largest partner, New York Presbyterian, for whom we provided free childcare for all of their employees throughout the COVID crisis. And while we're proud of this work and the opportunity to serve the city's heroes in their time of need, our work during this time has also afforded us a few key learnings about how to serve families safely and thoughtfully and with the same warmth that we think always made Vivvi such a special place upon our reopening that I'm sure made your school such a special place before they closed. In particular, following guidance from federal, state, and local public health agencies with input from our own in-house experts, and in partnership with our hospital partners and leadership teams, Vivvi has developed, tested, and implemented an augmented health and safety plan, which include everything from procedural to operational protocols to do all that we can to help make sure that everyone remains safe and healthy. So during a time when most schools have been closed, we're proud that our systems and protocols have been implemented, practiced every day by our team, and optimized. It's my hope that by the end of this call, you'll have a better sense of calm and confidence about your child's return to school and a toolkit to really understand what to look for when making that decision. So to tell you a little bit more about some of the things that we're doing, I'd love to pass it over to Ben Newton, our COO. Ben?
Thanks, Charlie. As Charlie stated, and he couldn't have said it better, our goal is really to ensure that you have a clear idea of the plans that we've put into place to reopen our campuses, but for you to also have clear expectations for yourself, for the schools that your children go to, as well as the other organizations that you interact with on a daily basis. Our perspective is, and we know this is an expectation certainly that all of you set, is that communities are built on trust. During this COVID period, the trust established does not end at the school day. and actually involves basically all the time families spend awake. We as an organization really believe that what we learn, we should share with the wider ecosystem, because we know that so much of our strength is based on what we've learned and we gather from working with others. There is a tremendous amount of information that we're going to be going over. And the way that we structured this presentation is to go through it thoroughly, but also know that you can reach out to, whether you're a family at Vivvi or not, we are more than happy to work with you as you begin to send your children back to school, and we're happy to answer any questions that you have. So to kick things off with our presentation, I'll hand it back over to Charlie. Charlie, you're on mute, sorry.
Whoops, still not up to task on Zoom, huh? As we were developing and implementing these new policies and standards, it really forced us to think about why we do what we do and how we want to do it. Being the best part of a child and their family's day every single day is the reason that we exist. But of course, health and safety is most important because it's the baseline for everything else. If you don't have that, you don't have a school. But in the mad scramble to sanitize, we also had to make sure not to sterilize the entire experience. Because if you start putting up glass partitions and you have teachers wearing hazmat suits, children will be scared. It'll impact the way that they learn, and frankly, so will parents. So the challenge here is really to go to great lengths to deliver world-class safety and health in a way that considers everyone's needs. I think you're going to see this reflected throughout our presentation today, as well as how we implement this for everyone, especially in 4 key pillars. The first is safety and compliance. The second is cleanliness and consistency. The third is community commitment. And the fourth is frequent and open dialogue. Those first 2 items, safety and compliance and cleanliness and consistency, those can be applied to anyone right now, whether it's a bakery, a real estate firm, a gym, or a used car dealership. But those last 2, community commitment and frequent and open dialogue, that's what makes a community special and a school special. It's what serves to reinforce the strength of its safety and its cleanliness, because you know what? Doing it together is the only way that this is going to work. Ben, do you want to go on to the next slide and you can start taking it from here? And you're on mute now.
Yep, had it. What you see in front of you is a wall of text. This is a version of our health and safety plan, which is a 60-page document for how we run our center on a daily basis that we pared down for our families. What I'm going to do is I'm going to take you through some of the key things that we're doing just at a high level to tease what we're going to be talking through in detail in a few minutes. One of the things that makes us really unique, and one of the things that you should certainly inquire about with your school, is who on the team interfaces with the Department of Health. At Vivvi, we have a head of compliance named Navita Ramlakhan, whose sole responsibility is to look at best practice around health and safety and make sure that if any incidents do arise, that we're directly working with local regulators, including the Department of Health and Mental Hygiene within the city. There are a number of steps that we put into place that we think all schools should as they think about a health and safety plan, because as you know, it just doesn't have to do with what's happening on a daily basis. It has to do with what people are doing when they're not on campus, just as much as it has to do with what you're doing to get a campus ready. So we divided our health and safety plan, and we're going to be walking through this into a couple key areas. First, before reopening, all of our spaces are going to go through professional deep cleans to ensure that anybody who is within those spaces, any concern about germs or the virus, are eliminated. In terms of doing our part, one of the things that's going to be incredibly important is how our staff shows up to school. We've set up systems so that our teachers don't even have to question about whether they come to school or not. One of the ways that we do that is we ensure that multiple members of our teaching team are tested every day throughout the week. In terms of what we expect for families, we expect our families to communicate with us regularly about whether they're traveling in and out of New York City, because we know that travel can actually impact the health and safety of the entire community. There are going to be procedures that we put in place for how people come and go from Vivvi. For instance, for the time being, we're going to be pausing all tours and open houses. So any information for prospective families is actually all going to be handled virtually. And finally, in our classrooms, we're going to be limiting, as are all childcares and preschools within New York City, class sizes to 15 children, but we're also going to be cleaning our rooms every hour. Now, again, this is a lot of text. We're happy to share and walk through this with families, but in the interim, I'll kick it back to Charlie as we start to walk through more specifically what each one of these columns contains.
Thanks so much, Ben. One of the key pillars of our approach to health and safety is technology and testing. Now, too often, technology is touted as a cure-all to every problem that's big or small. We know, and you know better than that. It's only useful when it's implemented alongside a thoughtful plan with rigorous procedures. And towards that end, we've partnered with some best-in-class companies and identified world-class technology to ensure that human error is eliminated as much as possible in the service of health and safety of everybody in three key areas. The first is consistent and accessible and reliable testing and screening for staff. So Ben will go into more details on this, but staff are going to be required to get tested both before they return to school and then every 3 weeks, such that at any given point, one teacher in every classroom is being tested on that day. Second is daily temperature checks on site for all. Ben is going to talk about some of the hardware that we've built into that. And the third is daily health screens for families and for faculty to really just reinforce our commitment to consistent and ongoing vigilance. Ben, why don't you start us off on the next slide?
So as Charlie mentioned, there are a number of things that we're putting into place to help people come to and from the center, but also make sure, most importantly, that they're doing that safely. As Charlie mentioned, we are requiring all teachers to get tested for the virus before returning to school, and also that all teachers are tested every 3 weeks, with at least one teacher, because we have 3 teachers per classroom, being tested every single week. So we always have our finger at the pulse of what's happening in terms of health and safety in our center. Because of our teachers have benefits through Vivvi, this is actually going to be a service that's free to them, and it will also ensure that we have a snapshot of what's going on. As part of this, because we've partnered with One Medical, all teachers are going to actually have an app that they access every day. So when they wake up, before they begin their commute to school, they actually do a daily health check at home, from taking their temperature to listing any symptoms they have. As we've said, and as we will continue to say, one of the things that we're trying to remove from our families, from our teachers' thought process every day is any concern about whether they should come to school or not. We're trying to make that decision as easy as possible for them. Secondly, one of our goals for bringing children in and out of the center every day is that we limit as much physical contact as well as any congestion. One of the things that we're doing in order to help this, by the way, everybody when they come into our centers every day, whether our teachers, our students, our parents, are going to have their temperatures checked. In order to do this in as contactless a way as possible, we're actually going to be using the same tools that some of our landlord partners use, specifically infrared cameras. And what we're going to be doing is setting a limit that anybody with a fever above 100 degrees will not be able to enter a center on a particular day. You know, again, schools thrive on strong communities. Strong communities are built on trust, and we're putting these systems into place so people feel comfortable. Finally, on the check-in process every day for families and children, we're using our partner app, Brightwheel. In addition to the daily health checks that we ask for our teachers, every day when parents check in and they scan their ID, and this is done in a contactless way with their phones, we actually have a health and safety checklist that pops up with parents so they can attest to us on every single day that their child doesn't have a fever, they don't have any symptoms, and they haven't been in contact with anybody infected, nor have they traveled to an area that has been impacted. With that, we're going to dive a little bit into the procedures that we've put into place in the center, and I'll throw it back to Charlie. Charlie, you're on mute.
Thank you so much, Ben, and you can actually go to the next slide. Before I dive too deeply into this, I just want to remind everybody that there's going to be a checklist that you get at the end of this to really go back to your own schools and to say, okay, are these the procedures that you're putting into place? If so, why? If so, why not? And ultimately, you'll have to decide for yourself whether or not you're comfortable with it. But these are some of the procedures that we're putting into place and that we believe represent the best-in-class procedures to keep everybody healthy and safe. So just as a reminder, you'll be shared a checklist with all these things at the end. Anyways, before reopening our school, we're taking some key measures to make sure that we're ready. And it's something that you should look for as you're considering on your end. On the cleaning front, we're actually conducting right now an electrostatic disinfectant and an antimicrobial treatment alongside our daily deep clean procedures. Those daily deep clean procedures also include steaming all of our furniture and making sure that every surface is disinfected. Second, all of our mattresses and cots in the school are going to be replaced. Only you can decide how important that is to you, but we're, out of an abundance of caution, replacing all of that soft furniture. On the procedure and training front, this is really important. We're working with all of our teachers to retrain them in important things like OSHA, diaper changing procedures, food handling, and cleaning. These are all of the bottlenecks where if you pay specific attention, you're going to be able to eliminate a lot of the risk. And finally, signage is going to be updated throughout the campus to remind everybody about those procedures and also to be mindful of health and safety. These are all intentional. These are all small but intentional details that together make up a substantial way to ensure that everyone is ready for a new day at school. Ben, you can go on to the next slide if you don't mind. So far, I know that this sounds like an awful lot and that we've gone through a lot of information. But one of the things that I'm proudest of is that we've been doing this all summer already. So while every other school is just starting that planning and implementation process, we do have this experience in muscle memory implementing a plan that was developed alongside and approved by our hospital partners with input from in-house experts and following guidance from all the local and federal health agencies. It's not going to be perfect, and I don't know that any plan that anybody puts out there will be, but what you should be looking for is a willingness to constantly look at new information, new resources, and new tools, and a willingness to identify opportunities to improve that then can be flexibly implemented in the service of your family's health and safety. Which brings me to my next point, which is something that's incredibly important to us, and that's the health and safety of our entire team, especially our teachers. Together with our head of people and our head of compliance, both of which may be unique to Vivvi as a school, we're working to implement this together because taking care of our team is paramount in order to allow them to deliver the best care and learning for your families. So as you start to consider returning, you're also going to want to look and see how your teachers are handling health and safety. Ben, do you want to take it from here?
Sure. I'm going to take the group through kind of three areas. First of all, the commitments that we're making to our families. Second, the commitments that we're asking our families to make to us. And third, I want to talk specifically about entry and exit procedures because it's going to be some of the biggest changes we make and some of the biggest changes that you should expect as you plan to go back to school. In terms of our commitments, as we mentioned, all teachers, all faculty are going to need to sign COVID attestation waivers and get tested before returning to school. In addition to this, while fever policies at schools typically apply just to children, we're going to be implementing a policy that any teacher who has a fever cannot return to school unless they're fever-free for 72 hours. We're going to be having our faculty update their dress code. So for instance, all faculty when they arrive on campus are going to need to change their clothes. Vivvi already is a shoe-free school, but we're going to make sure that our faculty has indoor shoes. In addition to this, we're going to make sure that they wear their hair up, that they have long sleeves, that they wear short nails, not a lot of accessories, and we're going to be providing them long sleeve smocks that they can wear over their clothing. In addition to this, as it relates to how we treat our faculty, we're constantly going to be maintaining and monitoring the DOH and CDC guidelines to make sure that what we're doing is best practice. In terms of our community commitments, the same fever policy that many schools adhere to is typically 24 hours. We're going to be expanding this to 72 hours for our families. So that means a child who has a fever cannot return to school unless they're 72 hours fever-free. In addition to this, as we mentioned, just as a reminder, we're going to make all families sign daily COVID attestation waivers through our Brightwheel app, and we're going to be asking families to communicate to us regularly about whether they're traveling in and out of our community. One of the big things that we're going to be asking for our families, and one thing that we encourage with you, we say don't worry alone. And what that means is we really want to hear what's on parents' minds. And most importantly, what we're also encouraging is that for folks to be empathetic. Teachers, just like parents, are concerned about coming back to school. And in order for us to do this successfully, in order for you to do it successfully going back to your schools, we really encourage you to be open and be vocal with your communities so that they know that both you care, you're holding them accountable, but also that there's nothing lying behind the surface of what, lying behind the surface, under the surface in terms of concerns. I want to wrap it up quickly, just talking a little bit about coming and going from the school, because these are some of the most significant policy changes as they impact parent experience before kicking it back to Charlie to wrap things up. First and foremost, one of the biggest things that, as you guys know, it relates to how we work safely within a COVID world has to do with social distancing. Using our Brightwell app, we're going to ask that all parents announce their arrival and pickup from school 30 minutes in advance to make sure that our entryways are not congested. We're going to be asking that all teachers, again, change their clothing upon arrival so that they'll be wearing indoor, fresh, clean clothes, and will be putting their personal belongings out of view. We're going to be asking the same for our children. And just so you know, all of our children, parents, and the approved caregivers that interact with drop-off and pickup, we're going to be taking their temperatures, and no one will be allowed within the space that has a temperature. And finally, all tours and open houses at our school will be virtual. So no prospective families are going to be allowed on site. In addition to this, for the time being, parents are only going to be allowed in our entryways and our vestibules. And so what that means is after we do our health check and check our children in, we're going to have a member of our teaching faculty that comes and receives the child and brings them to class. This is really, most importantly, going to help us prevent any congestion in our hallways and our classrooms. With that, I'm going to kick it back to Charlie to wrap things up.
Ben, thank you so much. And thank you everybody for joining us today. We're personally so excited to see our families back at school and looking forward to working with them. And I'm sure your schools are too. In order to achieve that goal, there's a lot that comes into play though. And I think you understand that. It's going to require constant communication and trust among your entire community. When we kicked off this call, one of the first things that we said was that our goal by the end of this was for you to have a better sense of calm and confidence about your child's return to school. So remember a few things. The first is, while we went through a lot of information, remember, we've distilled a 60-page health and safety plan that takes weeks of training to implement into 10 slides. And so this is meant to give you an overview and a toolkit to understand what to look for as you're considering returning to school. The second is, don't worry alone. Feel free to reach out to us. We're here for you and we're always happy to talk. The third is, and perhaps most importantly, trust your gut. You know your family better than anybody else, and only you can make the call on when and if and how to return to school. So with that, I would love to kick it back to Elizabeth for Q&A. And Elizabeth, I don't know if you want to drive Q&A or if you'd like us to.
I'd be happy to. I'd be happy to.
Outstanding.
We've definitely gotten a lot of questions. You've definitely given some amazing information and very extensive plans to be able to keep everybody safe. So some of the questions that have come through, one question was, what are the plans for outside contractors? I think, meaning teaching and enrichment, if you've, and when they bring in different types of teachers, what are those plans?
That's a great question. Ben, why don't you take that one? I think that you'd be best to answer that.
That is a great question. We're actually going to be pausing all of our push and enrichments for the time being. So for instance, we typically do Super Soccer Stars once a week with our preschool students. We're going to be stopping that. While we've done some distance learning for our families over the summer, we've actually made Super Soccer Stars virtual. So we're entertaining that, but we're going to be limited. We're going to be limiting those push and enrichments.
Okay, thank you. Another person asked, can testing for staff be mandated in New York City?
I'll take that one, Ben. We're a private company and an employer, so we have a bit more freedom to implement that than perhaps a public school would. I'm not sure what those regulations are, but on our end, all of our teachers are full-time employees that have benefits. And so it's one of the advantages of being structured in that way, that we're able to not only tell them that they have to do that to return, but to give them the resources to be able to do it free of charge. Great.
So what about testing for children? Is there any plan on that? And is that necessary from the CDC or the DOH perspective?
Neither the CDC nor the DOH have required, or to my understanding, Ben, you can correct me if I'm wrong, recommended the ongoing testing of children. Again, in terms of children and teachers both wearing masks while they're in the school, especially children over 2, that is, and testing of one teacher per week, we believe that's going to give us a pretty good snapshot of what's going on in the school at any given time. Ben, did I miss anything else on there?
No, I would say we do, a couple of big things that we do to help with this. One is we require, obviously, that all of our children are up to date with their vaccinations before coming to school. And one of the things we do require is a flu shot that we submit. And so we feel strongly that because we're doing such regular testing with our teachers, because we're doing active symptoms checking, this covers our bases in terms of what we're doing.
And Elizabeth, I'm sorry to jump in here, but Ben, can you explain the difference between the testing on every 3 weeks for teachers versus the daily health checks really quickly?
Sure. So yeah, absolutely. So within each one of our classrooms, whether it's an infant, toddler, preschool classroom, we have 3 teachers. Rather than having all 3 of those teachers tested every 3 weeks, what we're going to do is test one of those teachers every week. And what this allows us to do is always have a really good snapshot, making sure that we know the health and safety of our adults within the space every week.
And then can you talk about the daily health check through either One Medical or Brightwheel?
Absolutely. So through our partnership with One Medical, in addition to that being the facility where teachers can get free testing, all teachers are going to be provided with a One Medical app. So every day before they come to school, they have to answer a series of questions about whether they have a fever, do they have any symptoms of being ill, have they traveled. Many of these are very obvious questions, but we really want to make sure that we keep these health checks on record and we help teachers determine whether they should come to school or not. Those same questions are going to be communicated to parents through our use of the Brightwheel app so that parents don't have to question whether they come to school or not. It really helps everybody make easy decisions.
Thank you for clarifying that. Why long sleeves, someone wants to know? Is that because of less skin exposure? What has been found about the safety of long sleeves versus short sleeves or tank tops?
I can take this one, Charlie.
Sounds great.
Sure. In terms of long sleeves, that's exactly right. It's a protection just as much for our teachers as it is for the children around them. We look for our faculty to wear basically wear clean clothes when they come into the center on a daily basis. The long sleeves ensures that we're limiting anything that's potentially on their skin from commuting into the school, impacting anything within the classrooms. We have really robust hand washing procedures throughout the day. It's just an extra precaution that we've taken from the recommendations that we've seen. And in addition to the long sleeves, we're going to be having teachers wear, again, we're providing them with smocks as well that we wash every single day.
Wow. And I noticed too that there really isn't a requirement for masks for children in this scenario. Can you speak to that a little bit?
Sure. Sorry, Charlie. I would say, so on the mask policy, it is forbidden from the Department of Health for children under 2 to wear masks. In terms of children above 2, it is recommended, and at Vivvi, we are going to be encouraging parents to have their children wear face coverings to and from the centers. We're going to be encouraging children to wear face masks while they're in our common spaces and while in our classrooms. As you know, for very young children, this oftentimes requires a lot of redirection from teachers, and it's an area where we're asking that parents have that have a lot of patience with our faculty. It's going to be something that we're looking to enforce and keep up. Just so you know, if a child has a pre-diagnosed medical condition and they're forbidden from wearing masks, even if they're 2 years old and above, we will not require them to wear a mask in center.
Thank you for clarifying that and helping us to understand that. And, something too is, getting children used to mask wearing, now is a good time to start, as children are going to be needing to wear it more and more as schools open. Getting children accustomed to it is probably going to be a big piece of this. Another question that we have is, how do you purge airspace?
Yeah, this is actually something that's tied to the HVAC system in most schools. So in all of our schools, our HVAC system ties directly to the outside world, and so I think most schools you'll be able to see this. We're just extending the amount that we actually purge the space. I call it 20 minutes at the beginning of the day or a half hour at the beginning of the day to make sure that it's all new air that's coming in. And it always pulls from the roof rather than from directly outside. So you're getting pretty fresh air coming in. And if you speak to your school, they should be able to do that fairly easily.
Great. How do you, and this is an important thing about now that everyone's checking on a daily basis and staying out of school if they have a fever or not feeling well, how are you managing the staffing issues surrounding teachers potentially taking more sick days when they have possible illnesses?
Ben, why don't you take that one and talk about a little bit about our ratios to begin with?
Yeah, so it's a great question because as everybody knows, and this is pretty much true anywhere where you are in the country, your local departments of health will regulate the number of teachers to children that has to exist in any childcare center. Basically, for any group of children, whether it's 8 infants, 10 toddlers, 15 3-year-olds, you need at least 2 teachers per classroom. That's why we always staff extra teachers throughout our school, and there's always at least 1 extra teacher. So in the off chance that a teacher's sick, we have the ability to accommodate that, and so we always have extra bodies available to accommodate any fluctuations in staffing.
Elizabeth, if I may jump in, there's 2 questions that I know typically come up when we have these conversations that I'm not sure if we addressed, and Ben always does a really good job on it. So Ben, can you talk first about the limiting of class sizes, and the second about containing classes versus having them mingle with each other, and how that's a change from typical policy pre-COVID?
Sure. So this is really varied state by state. Some states have put restrictions on class size. Right now within New York City, class sizes are limited at 15. In our infant, toddlers, and 2 classes, this policy does not impact class sizes because each one of those age groups has a capacity of 8, 10, 12 respectively. Our 3s has a capacity of 15, so that will not be changed, but our 4s, which has a capacity of 20, will be limited to 15 children. One of the biggest things that's happening in terms of containment is we're really looking to have our classrooms remain as contained groups. What that means is that we're gonna, just like we're not gonna allow teachers to push in, we're gonna have a set of teachers, 3 to 4 at a time, that are dedicated to a specific classroom. This allows us to control any cross-contamination between classrooms. So even within our common spaces, we're actually going to be lining our hallways, controlling which direction people's children and teachers walk down the hallway. And in our gross motor rooms, what we call our wiggle rooms, basically our gym spaces, we're going to be removing common furniture that can potentially be cross-contaminated. If we do introduce any toys or manipulatives into those areas and the children use them, we'll be removing them out of circulation and cleaning them every single time.
Thank you for that. What happens when someone tests positive?
So it's a great question, and it's probably the biggest question. And I would answer that in 2 ways. The first thing is, the good news is schools don't have a lot of agency in their response to this. We are mandated reporters, and so we must report to 2 different parties. The first is all of our families and teachers, and the second is to the DOH. And the DOH will actually let us know what the next course of action is. Historically, what they've done is required, Ben, correct me if I'm wrong, a 48-hour shutdown, including a deep clean for everybody, and then a return. This is one of the reasons that they've kept classrooms from intermingling with each other, because you can theoretically contain any kind of contamination. Ben, did I miss anything on that question?
No, that's exactly right. You know, we work with local health agencies because there's a case-by-case scenario depending on who and how many people test positive in terms of how long those classrooms are shut down for.
So just to clarify, the classroom gets shut down, but not the whole school. It's the classrooms that have stayed kind of separate from mingling with others.
Historically, the DOH has actually requested the entire school to be shut down and be cleaned out of an abundance of caution. But nonetheless, the reason that classrooms are contained among themselves is so that there's no intermingling.
Got it. Now, are these suggestions from the CDC and the DOH, are they mandated across the country? Are different rules for different states? Are these rules? Are these suggestions?
So on the local level in New York City, the DOH, these are regulations that have been implemented. Now, in some cases, we go above and beyond them, and in all cases, we at least match them. On a federal level, there really isn't an oversight body, and so there are recommendations that are made, but to my understanding, there's no overarching set of regulations because it's so fragmented.
Yeah, and it is so fragmented. And there are times where that's good, and there are times where it can be really, it's not good for providers who may not be knowing what to do. This is why at Vivvi, and this is why we provide you with a checklist. We've done our best to really look at what multiple agencies and regulation bodies are doing, what also multiple states are doing, because there's learnings throughout the country, even if everything is so fragmented. And we encourage parents, just like other schools, to look up this information. And so what you see in terms of our policies that we develop is an amalgamation of different policies. And at the very least, we're meeting the expectations of the local Department of Health.
Great. And just to clarify too, someone was asking about, that you said that you're did a lot of this over the summer. Just to reiterate that you had worked with New York Presbyterian Hospital. If you don't mind just mentioning that again, because I think maybe that got missed, and that's such an important thing that you've already really implemented this when New York was the epicenter of the virus. So if you could share a little bit more again about that and what you've done.
So from March 25th, I believe, until July 1st, our school at 75 Barrack Street was one of a handful in the city of New York that was allowed to remain open as a special exception to serve first-line responders from New York Presbyterian. And so it was across that time in New York City for doctors, nurses, PAs, technicians, all employees of the hospitals that we were supporting their children, basically 6 a.m. to 10 p.m., 7 days a week throughout that time period.
And how did you do in containing the virus?
We were very, very fortunate to have experienced no illnesses of teachers, students, or families. So again, part of that is thoughtful preparation, and candidly, some of that is luck as well, right?
Well, look, I mean, I think of what you're doing certainly shows that it worked at a time when New York was the epicenter. And again, there's no guarantees, of course, but that's very valuable learning that you had during a very incredibly difficult time with very high risk families.
Yep. And you hit the nail on the head over there. I think we're all very fortunate to have had the opportunity to do so, and really excited to continue doing so. I think any hesitation that you hear from us is probably just not wanting to jinx or invite bad luck.
Positive energy. We're putting positive energy.
Positive vibes only.
One other question too that came up was, in terms of the 72 hours of fever free, is that something with like the CDC saying, like, if you're 72 hours fever free after having a fever, that's pretty gives you confidence that you don't have COVID?
That it's one of the big signs in terms of prolonged fever. So this is actually a good example of something that was recommended by the CDC and was not something in our local regulations. And so typically what that is within a child care center is 24 hours fever free from when the school has measured that. We just believe it's an additional important consideration as to whether a child should be seeking additional medical attention, and it just allows us to play it safe.
Yeah, and the flip side is, look, we all have children. I didn't mention this, but I'm the first dad at Vivvi. My 1-year-old Grace will be going back on August 1st or August 3rd, and I'm very excited. But we all have children. We're all deeply interested in this. COVID is not the only illness that's out there, and so again, this is about just overall reducing illness, of course, with a focus on COVID, but looking to everything and how we might be able to better support families.
Wonderful. We did have one more question about this. So if you don't mind clarifying, you said that it is children under 2 may not wear a mask, but children 2 and above, you were suggesting that they wear masks on the way to school and from school, but not necessarily in school. Is that correct? Can you just clarify that? Because we have a question come back about that again.
Yeah, Ben, why don't you take that question?
Sure. So we are just to under 2, it's forbidden for children to wear masks because it's there's fears of suffocation. In terms of children above 2, we are going to be doing our best to enforce a face covering policy for all of our children. On one level, we want our parents to help us with this so that when they're in transit to and from school, their children are wearing face coverings. While they're in school, we're going to ask the children we're going to work with children 2 and above to wear face coverings. The time when they would not be required to wear one is if that child ages 2 and above has a medical condition that forbids them from wearing it. So parents should be comfortable that there may be a few children in some of their classes who cannot, for medical reasons, wear masks, and also know that because it's 2 and above, these are very young children. And in order to force this well, it's something that our teachers will work on. But as always, they're going to handle this compassionately and do it thoughtfully. We're not going to, to put it directly, we're not going to throw a child out of school if they're not wearing their mask correctly. And we'll be working very closely with our children to develop rules and routines. And frankly, there'll be a lot of love and a lot of songs that our teachers sing with the kids around that. I mean, I think that's one of the really nice things that we've learned this summer with the kids through NYP is that the kids actually really get into the rules and procedures, and it helps that they really thrive off of the routine and structure. And wonderful early childhood educators do just a fantastic job just making it fun, and certainly there's song involved in that.
I'm sure I think a lot of wonderful songs and books that start coming out about masks.
Well, there's songs about everything. It's a great way to reinforce all the procedures and rules, and obviously the children get really, really into it. I think what Ben had to say right there is really, really important, and it's something that we put in as one of our pillars, and something for you guys to remember. The constant communication and compassion is going to be so critical to making this work for your family. And again, remember, trusting your gut, working together, and really communicating with each other, with your other peers, and with your own children to really help support the entire ecosystem so that we're all working in the same direction to help solve this and make sure that everybody's healthy and safe.
I think that's just such a wonderful way to end this webinar, is talking about that. And this has been incredibly informative. I'm really impressed with what you have going on at Vivvi, and really has pushed me to take a look at what's happening in my children's schools, in elementary schools and middle schools, to make sure that this return is safe. And I so appreciate your sharing this valuable information. I do want to let all of our attendees know that you will be receiving the school evaluation checklist via email. So keep your eyes out for that. You'll be able to have that. And you'll also have their website and contact information so that you can reach out to the school and ask additional questions and learn more about their incredible environment that goes beyond being safe during these times, but also an incredible education and loving environment for your children. Ben and Charlie, I thank you so much for spending this time with us today and educating us. Really valuable. And thank you to all of you who attended and joined us this afternoon. I wish you all a wonderful day, and that you remain healthy and safe, and your children do the same. So thank you for joining us.
Thank you so much. Have a wonderful day, everybody.
Thank you, everybody.
Bye-bye.